There were, as you know, during coronavirus, we were all forced to be vaccinated. Mandated, they call it.
The vaccine mandate has kicked in.
The government has already mandated vaccination.
It's not a choice to get vaccinated.
Enforcement measures in place will make sure that everyone is vaccinated.
You must get vaccinated.
The regulatory authority, amongst others here, is the TGA, the Therapeutic Goods Administration.
What is the TGA? We regulate therapeutic goods in Australia, including how they are manufactured and advertised. We are part of the Australian Government Department of Health.
Is it true that Australia has the highest proportion of funding of these regulatory bodies by drug companies?
In Australia, the regulator takes 96% of its funding from pharma.
96% of funding of the TGA comes from the pharmaceutical industry.
96% of the funding, as I understand it, for these regulatory authorities comes from drug companies, but more than 9 out of 10 drug company applications are approved. Is the almost exclusive reliance on pharmaceutical industry funding a conflict of interest when these regulatory bodies are approving applications from drug companies?
Oh, it was weird to me that the top regulators in the country were telling me, go talk to somebody who's an industry insider, because we don't understand the science.
Is this why ivermectin and hydroxychloroquine were banned?
In the intense worldwide race to find a cure for the coronavirus, a cheap, widely available head lice treatment could be the key.
We thought that maybe ivermectin might be useful.
Now tests by Monash University and Doherty Institute researchers show the medication can also stop COVID-19 growing in a Petri dish.
That a single dose of the drug was able to prevent the virus from replicating within 48 hours.
They had to destroy ivermectin and hydroxychloroquine and discredit it, and they had to tell everybody it's not effective.
A disturbing number of Australians are falling for a sham COVID cure, self-medicating with ivermectin, usually used in livestock.
Ivermectin, a drug which the Therapeutic Goods Administration has asked Australians not to use.
You weren't allowed to mention the little tablet. You were cancelled. Just remember, the man you're listening to was run out of his party and run out of government.
Kelly continually promotes discredited or unproven medicines.
On a silence debate on one of the most important issues ever facing our country.
Undermining confidence in the TGA.
Shame on you!
They had acknowledged that it's effective in anybody. The whole $200 billion vaccine enterprise would have collapsed.
What does that do for confidence in the vaccination program which is about to be rolled out across Australia?
All our hopes are riding on a vaccine. Yes. You need to be quiet.
So were ivermectin and hydroxychloroquine banned because the regulatory authorities were getting their money from drug companies?
The reason why they've been developed so quickly is very simple. Money, money, money.
Is the Therapeutic Goods Administration still taking money from Big Pharma? Which drug companies are paying now our regulatory authorities?
Does the TGA really think Pfizer has the best interests of the Australian people at heart, given that they are trying to delay the release of documents related to the COVID vaccine trials for a period of...
Senator, you've asked an official for an opinion, Chair. I do not believe I have to respond to a request to provide an opinion.
The overriding issue is this. Big Pharma was raking in the money from government. It had to be AstraZeneca or Moderna, so said the regulatory authority, and then they told that to government, and government aped that observation.
We're currently up to 136,000 reported injuries from the vaccine, and I think it's about time we had some honesty from the TGA.
Surely the payments should either be stopped or the Therapeutic Goods Administration should be shut down. I think we are short on critical answers.